All right, welcome. Monday Night Chat, World Without Rule of Law here on YouTube. So just want to welcome everybody, people in the stream or people watching after it posts the video. Like, share, dislike, thumbs up, thumbs down, doesn't matter. Interaction's good. Thank everybody for coming. I want to thank all my Patreon subscribers and supporters. Joining me tonight is Bruce from Backwoods Law and Kevin. Both of them are on my Patreon page. So over on Patreon, doing a lot of my creative writing stuffs over there. I got some original poetry, short stories, my series. I did the Outlaw Nation series is over there. New Babylon is over there in its entirety. And I'm in the process of putting an episode a week of that up on YouTube now. So I believe, if I remember correctly, there's 30 chapters. I think I just published 17 last week. And I have a new series, A Patriot's Faith. And that one's just starting to gear up. I just did 2 parts of chapter 7. And I believe the way it's going right now, that is probably never going to see YouTube just because of the content. It's definitely, from a conservative bent. So, it's about a Afghan war veteran comes home and runs for the Senate seat in his native Alaska, wins. He's just at the end of his second term. He decides to leave office. That's kind of where it springboards out from. And I'm not going to get too involved in the plot, but go over and check it out. Anybody's interested, it's Patreon, the subscription started $1 a month, so it's reasonable. And there's no obligation, so you come over and check it out. You hate it, you can quit at any time. But I want to thank these guys for joining me tonight. Again, Bruce and Kevin. We're going to do another kind of a continuation on our medical theme that we've done the last few weeks. And we had Mary scheduled to join us too, and she had something that prevented her from being able to come in. So it's just going to be us. But, we're going to look at medical kits, medical supplies, what people carry, what they carry at home in their vehicle, in their bug out bag. And we got actually Bruce and Kevin both kind of different ends of the spectrum, so to speak. Kevin is more of a survivalist rather than a prepper, if I had to categorize it. So he gears it to where, most everything he has or needs is going to fit in a backpack and he's just ready to go. Of course, I'm sure at home and in his vehicle, he carries additional stuff. Bruce has an EMT and a combat medical background, so he may have more extensive stuff, but I'm going to let these guys speak. I'm not going to speak for either one of them. I want to welcome Purple T-Bear. Good to see you. Good to see you tonight. Thanks for coming. Stephen Campbell. Hello. 3D. How you doing, ma'am? Good to see you. And welcome. I hope you all enjoy the stream. I'm going to turn it over to Kevin. He's prepared a slideshow, and he's going to get into it, what he carries in his kit, and we're going to springboard it from that point. Again, thanks everybody for coming. Bruce?
You turn it over to me or Kevin?
Yeah,
you.
I just had to yank your chain, Timo.
I know. You're not going to catch me. I'm on to your game.
You said you were turning it over to Kevin, and then you said me. Hey, anyway, you want to go ahead and bring that into the stream there, Timo?
Sure.
I've got a little slideshow that I did up. Just a real quick slideshow, not anything too complex or real big. Let me get over to my little deal here so that I can actually run it. Okay, so what I wanted to do was kind of go over some stuff that combat lifesavers in the Army would be carrying. It's called a combat IFAK. And in that combat IFAK, what they have is something called a combat pill pack. So this is the pill pack that would come in that IFAK that you would be issued. Typically, this is not like a regular Army thing. This would be something that Special Operations Forces would use. This would be if they know they're going to be out, say in Afghanistan, and they're going to be going back into the mountains. They're going to be away from anywhere where they're going to be able to land a helicopter quickly and easily, and they're going to be deployed for a week or two, and they're not going to have anything except relying on themselves. So they would issue these combat pill packs out to those types of soldiers. So that would be like your Rangers, Green Berets, if the Deltas were out there operating, Navy SEALs, Air Force PJs, if they were out there for some reason attached with some unit that was going to be out. This would be the type of pill pack that they would issue to them. Now, typically, they're going to have some type of medical personnel with them as a special operations group, but each of them individually would have these too, so they could use them individually as well as what's in their medical packs. Now, on the left, this is the original pack that they started using. I think it was back in like 2002, something like that. And as you can see, the ingredients at that time were Tylenol, Vioxx, and Getafloxacin. And they've gotten away from Getafloxacin, which was a broad spectrum antibiotic, and it's because it was causing some issues. People were having reactions to it more than they were expecting, and the FDA actually ended up getting rid of that as a common use broad spectrum antibiotic. They still use it, but it's only for very specific cases, and doctors have to be there to make sure that they're testing for certain things and testing your blood. So they took it out of those pill packs. In the center of the screen is the more up-to-date version that they're using now. And they have moxicillin, again, acetaminophen, which is basically Tylenol. It's just the medical terminology for it. And then meloxicin, which is it's like an analgesic muscle relaxer, basically. It's kind of like Mobic, which if anybody's had a muscle type of cramps or something, you probably have heard of Mobic before. It's kind of like a muscle relaxer, same type of thing. And that's what they're using in the pill packs currently. So those last two there are things that are prescription only. The acetaminophen that they actually include in the pill pack for the military is a 620 or 650 milligram extended release Tylenol, which is very difficult to find as a civilian. So you're not going to be able to go down to Rite Aid and buy 650 milligram extended release Tylenol, because it's a very specific type of thing. And basically, what is it, Bayer, I think, manufactures that. They manufacture it and they sell the majority of the stock just to like military suppliers and things like that, so the military can get them into their supply chain, and it's not really a civilian type of supply thing. Yeah. Picture on the right is actually they started including this. It was in 2008 or 2009. It's 800 milligram fentanyl based sucker. Basically, it's like a sucker like a kid would get at the dentist office or something, except this sucker has 800 milligrams of fentanyl in it. So that's if you have like a severe injury, like, you know, your legs almost all the way blown off. They've got the bleeding stopped, but you're in severe pain. They can give that to you. You suck on that sucker and you get the effects of the fentanyl. It's an analgesic. It will actually take the pain away and it will get you loopy, unlike the other pills. That will actually get you loopy.
So you know, when you talk about the antibiotics for, you know, I know staving off infections and stuff like that, you know, we talked about briefly before the stream started. Most people watching probably know, but you know, the over-the-counter substitute. I don't know if you want to touch on that briefly.
Well, if you go to any pet store, moxicillin, fish mox. If you go to the pet store and let's say you have a tropical fish and that fish has some kind of bacterial infection, they do at the pet store sell fish mox. It's made by the same people that make moxicillin for pharmacies and sell it to the hospitals and drugstores and everything. Mm-hmm. But it's for pet use.
Is it the same purity?
Yes, it's made in the same batches that are made for human consumption by exactly the same manufacturers. So it's not like there's different ingredients, different fillers or something in it. It's exactly the same as the stuff that they produce for human consumption. It's designated as being for veterinary use.
Of course, now we're not telling people to use that. I mean, obviously check with your doctor, see what he thinks about it before you go and get it and take it. We're not dispensing medical advice, but these are just well-known facts. So like, speaking for myself, of course, only if we're in an emergency situation, that's all we had, then it's a over-the-counter thing. So I probably would stock some of it in my first aid kit. I wouldn't be afraid to use it, but of course, again, I'm not telling anybody else to do that.
Absolutely. And the main thing you have to remember with any broad spectrum antibiotic, you don't want to take it unless you have to take it, because broad spectrum antibiotics, they can't tell what's a good microbe or a bad microbe. They don't care. It's like a flamethrower. It just goes out and it kills everything in its path, and doesn't matter if it's good, bad, or indifferent, it's going to kill it. And then that presents other issues for you, because if you're taking a broad spectrum antibiotic and you don't need it, number one, you could open yourself up to other infections because of that. Number two, if you overdose yourself on something like that, you can actually cause yourself issues in addition to not only being sick, but you could affect your vision. You can actually affect your blood to the point where you could actually create a poisonous environment within your blood because you're taking too much of this antibiotic.
And I know too, if you take it frequently, it'll build up in your immunity system, and then it loses its effectiveness as well. Correct?
Well, absolutely. And not only that, if you're using it and don't need to use it, and let's say you have some kind of minor infection and you're taking this, you may be responsible for one of those stupid super bugs getting started up, because it gets just a little bit, because it's not getting a medicinal dose of this antibiotic. It's just getting enough of it that it says, oh, this is something that could hurt me. So it starts changing its molecular structure so that it can resist that type of antibiotic. That's how superbugs get formed. So yeah, you don't want to play with the antibiotics. It's just not, it's not good for you anyway you form it. So what I did is, since this is something that Special Forces uses when they go out to the field, I said, okay, people are not going to be able to get a doctor to write them a prescription for these things and just have this stuff sitting around. So I wanted to come up with something that would be a suitable swap out and trade out for somebody to have in, let's say, a blowout kit, or one of your IFAKs that you purchase from, one of the stores online, Amazon or whatever. So I'm calling that basically a boo-boo kit.
Okay.
Basically, I
call it the same thing.
Exactly. It's just for civilian first aid kit. And of course I put on there, this is just personally what I would stock. It's not medical advice or direction. I'm just telling you, having medical experience, having field experience, having done this for real in the real world, this is the kind of things that I would want to have in my boo-boo kit so that I could take care of most things.
Sounds good.
So here's the realistic civilian version of the combat pill pack that you can do without getting too stupid and having to talk to doctors and stuff. And that's why I put in parentheses, no med control. It means you don't have a doctor that's directly telling you, use this, use that, here's protocols to use and things like that. That would be considered medical control. So for
Bruce,
go ahead.
Interrupt quick. 3D Tripper's asking, how seriously do you take the out of date on the antibiotics?
Any medication. There was actually a study done by Johns Hopkins Hospital about 15 years ago now, and they undertook this study because the Army Medical Corps was getting upset that they were having to throw away all of these medications on a regular basis. And I mean, they were, the Army stockpiles tons and tons of medications because they don't know when the next issue is going to happen, and they have to deploy 100,000 troops somewhere, and they have to have these medications ready to go instantly. They can't wait for them to come through the supply chain.
Sure.
So they commissioned this study, and they actually found when they went through and did this study that unless it's a liquid medication, those go bad very quickly. Any type of liquid medication. So any of your liquid pain relievers, any of your liquid antibiotics, all those, they don't have a very good shelf life at all. I mean, if it says expired, assume it is expired and it's not going to be useful pharmaceutically.
Okay.
With all of the
And if
pills,
it expires, am I right to assume that it's not going to necessarily harm you? It just loses its effectiveness.
it depends on the medication. There are medications that when they expire, they can become toxic. So any liquid medication, what we're trained in the medical profession to do is if it's a liquid medication that is expired, you consider it to be toxic and you do not use it on a patient.
Okay.
That's the baseline that you operate off of. That's what I operate off of. I don't want to do something that's going to hurt somebody. So if it says it expired and it's a liquid med, I'm not messing with it.
Okay.
Now, technically, an IV solution is considered a liquid medication. However, it's not really a medication. I mean, it's basically salt water. That's based on an IV bag. If it's just IV saline solution, if you can read the front of the bag through the back of the bag in the liquid and it's clear, it's not cloudy at all, that's a good bag of IV liquid.
Okay.
And
Now
that's
that's
what
mainly just to bring your fluid level up, like stave off dehydration, or if you're losing fluids, replenish your like electrolytes or whatever.
right. And they do have specialized ones like banana bags and stuff that will they have added ingredients, electrolytes and stuff that will actually bring your electrolyte levels up. But basically, it's kind of like a fluid challenge. Basically, if you're dehydrated and you need water, that's basically what that IV solution is going to do. If you're going into shock, it will help with shock. It's not going to stave it off completely, but it will help with shock. It depends on why you're going into shock. Are you going into shock because you're dehydrated, or are you going into shock because you're losing blood? If you're losing blood, it's not going to do anything for you because all that IV solution is water. It can't carry oxygen. So remember, I said the last time we were on, stop the bleeding, because if you keep the red stuff in, I can save you. If you don't, I can't do anything for you.
Yeah. Yeah.
That's why, because I can pump all the IV solution in the world into you and it's going to do you no good because it doesn't carry oxygen like your blood does.
Okay.
So that's kind of IV in the medical EMS world. IVs are just one of those things that I can do it. It will help stabilize someone if I'm in a place where within 10 to 30 minutes, I can get to a ER and have a medical team working on that person. It will help them. It will make it easier for the doctors to do things. But if you're grid down, there's no medical help around, our IV is going to be that big of a thing only if you're dehydrated, really. Because you're not going to be transferring that person to definitive care somewhere. So there's not going to be a surgeon waiting somewhere to do things on this person that because you gave them IVs, they're going to have the proper blood volume so that they can do those things. So really, IVs would be useful for dehydration, things like that. But other than that, grid down, unless you're at a hospital and you have all these doctors around just sitting there doing nothing, it's not going to do much for you.
Sure. Or have some kind of surgical solution.
Exactly.
Yeah.
We call that definitive care in the EMS world. That's somewhere where you can get, and that there's a doctor there that can fix you and get you either back to where you were or as close to where you were as before. That's definitive care.
Okay.
So with this civilian version, basically the Tylenol 500 milligram extended release tabs, if you can find them. If not, get the rapid release, because the rapid release is going to take care of the initial pain onset. And that'll help you a lot at the beginning because a lot of people can't take pain. Some people have high pain tolerance. Some people have low pain tolerance. Either case, if you give them the Tylenol and it helps initially, they can usually work through the pain later on because it's not as much as the onset pain. So that's why you'd have that in your bag. The other thing is the Motrin, anti-inflammatory, like I said before. Sprain an ankle, sprain a shoulder, wrist, elbow.
Yeah, I would think that would be hugely valuable.
Yep. You take that, and is it going to immediately fix the problem? No. You're still going to need to wrap it. It's still going to be painful, so you may need to take some Tylenol with it as well. But it's going to keep the inflammation down, because the inflammation is going to prolong the recovery time. If it's inflamed and it's swollen up, it's going to take even longer for you to recover because of that inflammation.
Yeah, and inflammation causes pain. So
yes, it does. Wouldn't know how you know that, Tim.
The ibuprofen is more really not a foolproof remedy, but it's actually alleviating the symptoms, where the Tylenol is kind of just masking the symptoms.
Well, an ibuprofen is actually a different one. I didn't have ibuprofen on here. It's similar to Motrin, but ibuprofen's more used for like arthritic pain, like pain in the joints and stuff like that.
Okay.
And you do have to be careful.
Ibuprofen.
What's that?
I thought Motrin was ibuprofen, or had ibuprofen in it.
Ibuprofen has Motrin in it, but just straight Motrin does not have ibuprofen in it.
Okay.
That makes sense?
Yeah.
There is Motrin in ibuprofen, but it's a mixed pill that's actually mixed by a pharmacy. And Motrin, you can buy just Motrin, which that's all that Faye and I buy for the house here. It's just regular Motrin. She does have some ibuprofen because sometimes she likes to take that. And I usually just take Tylenol. So that's why I had those two on there, because those two are the most effective at doing what they need to do in a situation where you have some type of injury. And then down at the bottom, I put, due to common occurrence in or around a base camp situation. So let's say this is grid down. You're not going to be going hours or days or weeks away from your base camp if it's a grid down situation. Typically what's going to happen is you're going to be somewhere around a base camp type of operation, where you have like a mutual assistance group, and you're going to be walking around the woods and you're going to twist an ankle, or you're going to fall down and hurt a shoulder or an arm or something. Yep. So in that type of situation, these two, acetaminophen and Motrin, go ahead, pop those real quick while you're out in the field. When you get back to base camp, go in and see the doc, whether it be an EMT, a paramedic, an actual doctor that you have that's in your base camp. Go back and see them and let them decide what to do additionally. But those are the things that I would do field wise for something that's going to happen close to a base camp type of setup, because you want to have a medical type of person making the determinations to go for further treatment, because you don't know that much about medicine. So why try and treat yourself with antibiotics and stuff if you don't need them and you don't have to? That way you remove that from being a problem for you. You're not going to have to worry about overdosing or underdosing, which can be a problem. So that's why I put that in there, because that way you at least have someone, even if it's only somebody who's an EMT, at least they have some type of medical training and say, yeah, this is something that when the grid was up, we would treat this with, amoxicillin or Cipro or whatever. And they can at least have that knowledge. That's better than you not knowing and just taking something because you think it's going to help you.
Sure. Makes sense.
So, the Boo Boo Kit OTC stock, what I came up with on this slide was, let's say you have something that you keep at your house that you have stocked, and you may use it on a daily basis or you may not use it. It's something that you have set aside for, if the grid does go down, you have these supplies. These are the things that I would put into that. And you see, I do have ibuprofen on this one. And I also included Benadryl on this one. Number one, because Benadryl will help if you have somebody that's having an allergic reaction to something, even if it's a bee sting and they're allergic to bees, as EMTs, paramedics on an ambulance, we actually have Benadryl that we can give them.
Bruce, do you know if they still, for a while, Benadryl was making, I'm not really even sure what to call it. It was like a flat dissolving thing that you could put on your tongue and it just instantly dissolves.
That was
Do you know
the
if they still make
dissolve.
that?
They called them dissolve tabs, I think. You may still be able to find them around. We never used them in the EMS
I used to keep
world.
them in my wallet because I always, always had them with me.
Yep. Yeah, they may still make those. I don't know. I mean, I never used them professionally because we either had Benadryl, liquid Benadryl that we could give you IM, which is intramuscular. We could give you a shot of Benadryl if you were having a severe allergic reaction to a bee sting or some type of insect sting.
Yeah, 3D Tripper's saying that she carries it for that purpose for bee stings.
Yep. And if you don't have an EpiPen, the Benadryl is going to help some. I mean, it's better than nothing. It's, if somebody's really allergic to bees and they get stung by a bee, at least if you can give them 500 or 600 milligrams of Benadryl, guess what? That's going to do something for them. And maybe it keeps their windpipe open just enough that you're able to get them back to your base camp and they're able to have the EMT there help them out. And the EMT maybe has a actual EpiPen that's still good and can hit them with the EpiPen, something like that. So, and Benadryl is not something you have to have a prescription for. These are all over the counter stuff. Okay. So that's why I wanted to have that in there.
Yeah.
And the liquid Benadryl is good because if you have kids, number one, it's easier to dose for a kid with liquid, and it's easier to get the kid to take a liquid than it is a pill a lot of times. So that's why I said liquid and or tabs. That's why I put that in there. In addition, in the Boo Boo Kid OTC stock, if this is a grid down type of situation and you have a group of people, a mutual assistance group, or even just a group of people in your neighborhood that maybe are not a MAG, but you're together now and you're working together, so you really are a MAG, you can get together and you're going to have all different age groups there. You're going to have older people, younger people, middle-aged people. And if you're coming together to help each other and this is going to be an extended type of situation, it's not going to be over tomorrow. It's going to be a month or 2 or 6 or 9, like this stupid COVID stuff is. You could get together as a group, a home area group, and just say, okay, if we have an injury, what type of medications do people have? Because, we can't get to the pharmacy. We can't go see a doctor. We do have, 3 EMTs that are here because they can't get to work because everything's shut down or whatever. So, they can help if we have somebody who's injured, but what type of medications do we have? And that's where, pooling together as a group, you may find out you've got people that have Tramadol, which is a pain reliever for like arthritic type of pain, things like that. Tylenol 3 with codeine. That's issued out a lot by like dentists and stuff after you have like some type of dental surgery. Vicodin, Percocet, Oxycontin, with the different age groups of people that, you're probably going to have a cross section of in a community. If you all come together and pool those together, and some of those may be stuff that, they have in their cabinet because they had their wisdom teeth out 5 years ago and they just never used the Vicodin they were given or the Percocet or whatever.
Yeah.
And guess what? That's usable.
That's pretty common. A lot of doctors, I know my doctor's pretty, and we build a relationship with him. He knows, like, for me, I have a hard time taking pain meds, any kind of narcotic pain med. So I've had issues with my back before where I've had to take them. I can only take them for a day, 2 doses max, and then I'll start to vomit. So I got to be in and I haven't had to take them in years, but back in the day when the trauma was newer, there were times when I had to. And so he knows that I can't take them, that I won't take them that much. So he doesn't have any problem prescribing them to me. If I call him and say, hey, you know, I'm having a couple bad days, I really need something, he'll give me a prescription. And then I take one or two, that's it. And then I've got, you know, if he gives you 10 or how many, you got extras, right? And then
Right.
year later you do the same thing, and so you can almost stockpile them in that way too. But then overall you're talking over years, so I know you're saying that, you know, the expiration date isn't that crucial, but at some point, I mean, I'm sure you don't want this stuff hanging around if it's 8-10 years old.
Well, actually, in the John Hopkins study, they tested medications that were up to 40 years old, and they were still up to 90% effective at that date.
Wow. Okay. Well, that's good.
And that's for the pills now.
Sure.
Now, there are certain pills that you do not want to do that with. Aspirin would be one of them. And a very easy way to tell if aspirin is bad, if you pop the lid on aspirin and you get that rotten egg type of smell,
Yeah.
or you get something like curls your nose when you open a bottle of aspirin, do not take it. That means that aspirin is expired and is turned and is going to poison you.
Okay.
Because aspirin actually turns into a toxic substance when it expires. That's one of those meds that you do not, if it says expired, just believe it. Don't mess with aspirin. If it says it's expired, don't use it. Just throw it in the trash. Don't worry about it, because that is one of the ones that does turn into a toxin and can actually poison you if you take it.
Mm-hmm. So there's a viewer in the chat, Teddy, saying, so about the expiration dates on antibiotic tabs and also painkillers. I'm not sure if I understand the question. Maybe you could clarify it. He may have just popped in. I know he might be asking what we went over before about the.
You can go ahead and close that slideshow there, Timo. That was the last one.
All right, take that out. And so, okay, so the other side, you know, is I'm talking to Kevin, right? He's more of a, and I'm going to let him talk because I don't want to misrepresent it. But in my mind, I don't know if it's the right terminology. He's more of maybe of a minimalist, right? Like he's relying more on skills than preparedness items. And I would categorize that more of like a survivalist than a prepper. Although, you know, certainly the lines grow together there, the circles overlap. So I'm going to let him talk a little bit about that. But I know he's a little more streamlined. I think, you know, he carries a backpack with him and has a lot of different things in there. And so he may be in a situation where a lot of these things you're saying, although they probably don't take up a lot of room, I don't know how much of that he could actually carry. So he's looking at, I think, more of, you know, medicinal herbs and stuff that he can get, you know, in nature. And I think that that's pretty fascinating actually in itself. And so, Kevin, if you want to address that, I'll let you take it away.
Sure. For me, yeah, definitely. I would say I kind of have a mix. I definitely carry gear. I mean, I have a boo-boo kit like Bruce was talking about. I also have a small trauma kit that I always have in my packs and stuff. But I also try to supplement as much as I can with other knowledge, because I might not have, you know, my kit. I should have it with me, but you never know. I might not have my kit with me. I do spend a lot of time in the woods, not as much as I used to, but you know, so for me, I also wanted to have a backup plan. I always say you should have a backup plan. So I tried to learn some of the medicinal plants that are around, or, you know, how to splint using something more along the line of a branch. I might not have the stuff that, you know, an EMT or a firefighter or, you know, a nurse or a doctor might have. And obviously it's, you know, for me, it's definitely not near like the knowledge that Bruce or Mary has. For me, it is just to deal with until we can get somebody like Bruce or Mary to where we are. You know, and my training, a lot of it came from, you know, jobs I've done, like executive protection and, and stuff like that, where we had to take training to get, certified in basic first aid and AEDs, CPR, stuff like that.
Mhm.
And so because you're on scene, so you had to have enough to stabilize a person until the EMTs arrived, or till the
Sure, it's all just about buying more time.
correct.
And that's good. It was interesting because we talked a little bit about this privately too, and I was telling Linda because she got that real bad batch of poison ivy, and you were saying how it isn't God good how he does things like poison ivy grows, and then I forget, was that the plantain?
That's
the
jewelweed. Jewelweed.
I'm sorry, say it again.
Jewelweed.
Jewelweed, and they grow together, right? Like that's pretty
Usually you can find them right next to each other. It's kind of neat the way that works. And I mean, you take like jewelweed. Well, it's great for poison ivy, but it's also great for any type of dermatitis type issue. I've had been out in the woods and get tore up by mosquitoes. You take jewelweed, rub it on, and the next day they're gone. You don't even see them anymore. If you're not allergic to bees, it helps, relieve bee stings, stuff like that. There's definitely a lot of stuff, even, Bruce was talking about aspirin. Well, aspirin was based off of white willow bark, a willow tree. We have willows all over the place, and that's where aspirin originally came from.
Huh. That's interesting. And so, we talk a lot about building skills and the importance of building skills. Of course, putting back supplies is good too. But really, we need to have that skill base. And so I think if we want to look at that medicinal herbs, medicinal plants, that's a pretty valuable skill. That's a pretty valuable knowledge base to have.
It definitely is. One thing I would say, in kind of going along with what Bruce was saying, you got to be careful, because you want to make sure that you're learning from somebody that actually knows what they're doing. To take a book, you might be able to learn some stuff, but there is things that if you take the wrong thing, or you take too much of it, it can either kill you or make you wish you were dead.
Sure.
So it's not something you just want to mess around with. It has the same, I'd give the same warning that Bruce would, that you want to be careful.
Sure. Good advice in every situation. But that's a interesting thing, because I would like to be able to source that, find a source for, a reliable, valuable source, because that's the hardest part with a lot of things. Even if you're looking on the internet or through books, right, is weeding out the ones that aren't correct or aren't valuable. So I wonder if we could try to do that. If we could find a course or a book series or a source for that information. I could link it to the description when the video posts. I
do have a couple good suggestions. I'd have to look them up and get them to you, because I don't have them off the top of my head.
Yeah, well, if you think of it afterward, maybe I could add them
Definitely.
I can add them at any time, sure, to the description. I'd be interested in looking at mine too, actually.
Too, there's different times of the year where something might be good and something might grow, or there might be other times of the year that it's gone bad. It's past its usefulness. Mm-hmm. So the more you can get out with somebody that knows what they're doing, the more you can learn throughout a year. Not just one time you walk out in the woods. Middle of summer, it might be totally different than if you're out there in the middle of winter.
Yeah, that's a good point. Right? Yeah. Huh. Especially up here in the Northeast, where
definitely
it's a pretty definitive change between summer and winter.
Definitely.
3D saying look-alike mushrooms can kill you.
Well, there's a lot of not just mushrooms.
Yep.
There's a lot of plants that have lookalikes. There's a lot of people know what Queen Anne's lace is. Queen Anne's lace is the edible. It's a wild carrot, but it also has a very close lookalike, which is water hemlock. One's gonna either kill you or make you wish you were dead. The other one's edible. You don't want to mix the two up.
And
You know,
that's
so
what
there is a
happened.
lot of
That's what happened to
stuff like that.
Christopher McCandless in back in Into the Wild. There, he was, you know, a lot of you are familiar with the story, but he was looking through an edible book, and that speaks very, you know, pointedly to your point about mistraining, because he had this edible book, wild edible book, and he relied on it, and he misidentified a plant, and you know, several pages later, there it was, and it looked very, very similar, had the same color berries, but one was food and one was poison. And he had the wrong one, and he's starving, so he was eating it, and it basically made him starve to death from the inside. And so that's, you know, that's a lookalike there. So, and also, again, it speaks to the importance of knowing the source. And I think maybe he was a little overconfident with the knowledge that he thought he had, but he really didn't have.
Definitely. You if you don't know 100%, it's definitely not something you want to mess with.
Yeah. Good point.
No, like I said, I do carry. I mean, you know, that's not all my stuff. I definitely do carry, you know, kits with me, and you know, I'm kind of curious what Bruce's thought is. You know, like I said, a boo-boo kit. What I did was I took a standard first aid kit based off of wilderness first aid kit, because that was at the time where I was spending most of my time. And I doctored it up. I think I told you, you know, I doctored it up. I added extra things, you know, extra of the acetaminophen and ibuprofens. So I added extra stuff like that. It's got the ammonia and iodines and, you know, your basic bandages and Band-Aids. But I also added a few other things, like I added a sewing kit and I added an eyeglass repair kit. Things that you might not think about. Added matches, waterproof matches are in there. I have a lighter in there. I have a pen in there. Just some extras that you can take your basic first aid kit and think about where you're going, and you can add to it and tailor it a little bit.
Mm-hmm.
But I was kind of curious too, what Bruce's thoughts are. You know, I do carry a small trauma kit. My trauma kit, I obviously have tourniquets, and I have quick clot gauze rolls, and I have Israeli bandages and chest seals, you know, and then you're obviously your shears and your regular gauzes and stuff like that, sutures. And so I was curious what Bruce, you know, would say, like, what is if you're building a basic trauma type, you're going to be a little while before you can get either an EMT, or, you know, you're already on the scene, and, you know, what's some things that you would suggest throwing into a basic small carry kit that you could have kind of with you at all times?
Just one of the basic things is, and I keep on going back to it, is you need to, if you're leaking, you got to stop the leaking.
That's exactly, yeah. Yep.
I mean, that's the most basic thing. So gauze, Kerlix, definitely more than one tourniquet, especially if you're going to be carrying this kit because you're carrying a firearm. If you carry a firearm, you should have some type of stop the bleed kit on you, because
that's what
if
we
you
were
have
taught.
a firearm,
Yep.
Where do most injuries occur with firearms? In the extremities. How do you stop bleeding in an extremity? With a tourniquet. So you better have at least 4 on you if you're going to be out carrying. Technically, as a concealed carry person, you should have at least 2 or 3 tourniquets on your person, because if you're going to get injured, it's probably going to be in an arm or a leg, because people are not dead aim shots at 20 yards with pistols.
My instructor said, if you can make holes, you better be able to plug holes.
That's right. So just a basic trauma kit would be, have at least 1 or 2 of the Cat 7 tourniquets, have some Kerlix, have some gauze so that you can stuff a bullet wound, if that's kind of what you're thinking is going to be the issue. I mean, 99% of the people in this country, that's not going to be the issue. Now, if it's grit down, that's something entirely different. But just your everyday walking around type of bag, have a couple of tourniquets in there, have Kerlix, have gauze. The hemostatic agents are okay right now because we're grid up. You have to remember with hemostatic agents, number one, when you put that on there, it is going to burn like an SOB. It is going to feel like they are on fire when you put it on them, number one. So they're not going to be happy with you. So be prepared for that. Number two, that agent has to come out at some point. Otherwise, it's going to start festering and it will cause an infection. So that is something to keep in mind if you have the granulated Celox or whatever, and that's your go-to. You know, if I get a bullet wound, I'm putting that in there. Yeah, that's fine right now because you get to the ER, they realize, oh, they use Celox on them, so you know the surgeons go in and they start cleaning it out. You can't just put that in and leave it there forever. It doesn't get absorbed by the body.
Right, that's a good point.
That's something to keep in mind.
Yeah, we were told the same thing, that once you put it in, make sure that you don't mess with it. And the doctors are the ones to remove it.
Yeah, because if you leave just a little bit of it in there, it can cause a massive infection that could cause the limb to have to be amputated or whatever. So,
I'm sorry. Can we? I'm also watching the chat, and there was something that just got brought up that I'd like to get Bruce's opinion on, because what I was told by Special Forces to stop the bleed. Course I took was by Special Forces that he has combat. I mean, he's been out in the field. He knows. He's definitely
probably an 18 Delta. He's probably a Green Beret medic.
Yes, he is. So, somebody just brought up about tampons and carrying those. And for a while, that was one of the biggest suggestions, that if you get a bullet hole, shove it in there, you're good to go. And everybody was saying, that's what all the Special Forces guys carry. And he said, that's the biggest crock ever. He says, we don't carry that stuff. He says, they're actually designed to draw blood. And he says, that's the last thing you want to put into a wound, is something that's going to draw more blood to it. So I'm curious what your thoughts are, Bruce.
What we used them for in the ambulances, they actually had them in the ambulances, but the only reason we had them was because, let's say you're working a mass casualty incident, and let's say it's an active shooter incident, and you have somebody who has 15 bullet holes in them, and you're trying to keep track of entrance wounds, exit wounds. You can actually just put one of those, just shove it into the bullet hole slightly, so you can sit there and count. Okay, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, how many exit wounds do I have? 1, 2, 3, 4, 5, 6, 7, 8. Oh, there's 2 that are still in the body. We got some major internal bleeding going on probably. We got to put this guy as a priority, get him on a chopper and get him out of here. That's what we would use them for.
Gotcha.
But yeah, that's not something that would be, I don't know who started that. That was probably somebody who was a what do they call them in the prison? Shit house attorneys.
Yeah.
That was probably one of those that came up with that somewhere.
That was one of the first things he told us. He says, I don't know who started this. He says, we do not carry those. He says, we carry real gear. He says, you don't want something that's going to draw. It's designed to draw blood to, out. He says, that's the last thing you want to use as a wounds packing, unless
absolutely,
unless you have nothing else to have.
Well, and the other thing is you wouldn't maybe be able to use it as a wound packing material. That gauze is ideal for that. And number 2, it's because gauze will not stick to the wound.
Right.
So that's another key factor, because once you get that clot made, you don't want to pull the clot out when you pull the gauze out. So, but that's something that you guys wouldn't have to worry about. You're not going to be pulling the gauze out anyway, but you could use a tampon, split it open, unroll it. And like, let's say there was an arm lac or something, a cut on the arm that was longer than, a regular bandage could handle or something. You could actually put that on top of that. That would be okay. And whatever you do, people do this all the time, and I always cringe when they say they do it. Do not use peroxide on a wound. There's a very simple reason for that, because what you're doing with the peroxide is you're killing all of the live cells around the edge of the wound. You're killing them with that hydrogen peroxide. So do not put hydrogen peroxide on a wound. because you're going to increase the time it takes for that wound to actually heal by doing that. I know everybody, oh, my mom used to put that on me all the time. Yeah, well, guess what? That's why it took 3 weeks for your wound to heal.
I'm guilty of it.
And it stings like hell, but guess what? You wipe it with an alcohol pad. That takes care of the bacteria. That takes care of cleaning it and everything. Actually, one of the worst things is if you get a big laceration, you have to actually debride it before you actually put that bandage on. That is painful. Trust me. Because you don't want to go and put a sterile bandage over a wound and have it start healing and you have some foreign object inside of the wound. You need to, pour alcohol over it and look at the wound, visualize it, and make sure there's not a piece of wood bark that's still in there or something. Because what that's going to do is just like the Silox. It's going to sit in there, it's going to fester, and it's going to cause an infection.
Some kind of magnifying glass probably wouldn't be a bad item to have in a medical kit as well.
I have one of those. That's a good point. That's actually one of the things that's part of the eyeglass repair kit I have is a small magnifying glass.
Yeah, I know my eyes aren't the greatest. That would make a lot of sense.
Obviously for me also, it also has. I like things that are multi-purpose. I don't like to carry specifics if it only has one purpose. It's a lot less good to me. So a thing like a magnifying glass, obviously it will help me see, but it also you could start a fire with it. So that it has multi-purpose.
Oh yeah.
There's a lot of things in
Redneck
medical kits that start fire.
asking, how do you bubble out dirt out of a wound?
You don't bubble it out. All that you do is, number one, you try doing just with plain regular water, pouring water over the wound. A lot of times that will get most of the debris out of it if there's like dirt or something in it. If it's something that will not remove with just pouring water over it, that's when you have to have the forceps or the tweezers, and you have to go in and you have to get that out and then pour water over it again, and you go from there. You keep doing that until you make sure that it is fully debrided.
Yeah, wow. That seems like it could be a tedious process.
It can. Why do you think surgeons and doctors get paid so much money?
Yeah, well, again, if you have a viable surgical option, but if you're, in a grid down and there's no hospital to bring them, then you've got to make sure you can do that of whoever's attending to the person. Otherwise, you're going to have infection, right? So there's a lot to think about there.
That's why right now is the time. Most people live in an area where you could go down, and you even did it, Tim. You can go down to your local, well, maybe not right now because of COVID-19, but if you go down to your local volunteer fire department, they will do stop the bleeding courses. They will do CPR courses, and a lot of them will not charge you, or it may be like it's a American Heart Association or CPR is usually with the Red Cross, one of those, AHA or American Red Cross, one of those two agencies, and it's minimal. It's $10, $20. And is it going to make you a field medic? No, but it's going to give you the confidence of, okay, I understand how to stop bleeding. I understand how to start someone's heart again, with using CPR. Does it happen every time? No.
We had a really, really good instructor do the first aid kit at the volunteer fire department. It was Patrick Henry, volunteer fire department in Virginia. And they have multiple classes now. Of course, they did shut down because of the COVID, and I'm up here now, and up here it's more paid fire departments, so you really don't see that, but they did not charge for the courses. If you wanted to have the certification card printed, then there was a charge for that. But if you didn't care about the card, so to speak, then there's absolutely no charge, which is good. LP, we have a viewer in the comments, LP, saying cleaning wounds, curious. Could you use the saline solution you use for your contacts?
Yep, I did answer. You can use that as long as it doesn't have something in it for like hydrating the eyes or something.
Okay.
There's some of them out there that will have that. That's usually specialized prescriptions type stuff.
Now, this might sound like a stupid question, but saline is salt, right? So isn't that rubbing salt in the wound? Like, isn't that going to smart a little bit?
What do you think IV solution is?
Right. That's what I'm saying. If you use that to clean out a wound, though, isn't that going to...
That's how we clean out wounds in the field as an EMT or a medic.
So when you're saying wash them out with water, you're saying saline solution water.
That's what I would use because I would have that available if I was on an ambulance.
Okay.
Canteen water. If it's good for you to drink, use it for a wound.
Okay.
And technically, I mean, it wouldn't be good, but technically you could drink saline solution, but wouldn't be the best for you, but you could technically drink it. So
yeah. Interesting. All right. That's good.
It'd be a limit. It'd be a limited dose, though, wouldn't it? Wouldn't it have a adverse effect if you drink too much of it?
yeah, because you're going to be drinking salt water, basically.
Right, so
dehydrate
you.
Initially, it would quench your thirst, and then eventually it's going to actually be the reverse effect. However, if I put it directly into your vein, then it helps you. Figure that out. That's just because of the biological systems in your body. It's because it's going through your intestine. If I'm putting an IV in you, it's going directly into your bloodstream. That's why you're able to use it, and your body will absorb it that way, but it won't absorb it if you put it in through the normal means of drinking.
Yeah, it's interesting. There's a lot of information to disseminate there. I think the one takeaway though, for sure, the training. And again, if you live in a rural area, the volunteer fire departments are a valuable resource for sure.
Well, yeah, and I mean, if you want to take it to the next level, I mean, if you go down and you say, okay, you know what, I get this, I can handle this. If you tell them, hey, I'll be a volunteer with your department, they will send you, get you your EMT certification. They'll send you to get your paramedic certification. And depending on the area you're in, if they have volunteers that actually man like the life flight choppers and stuff, they will get you certified to be a flight medic, get you certified to be a PA. I mean, it just depends on the area you're in, what the volunteers do in that area. And then usually it's your volunteer fire department that pays for all the schooling, all the supplies, because when you get done, then they have a paramedic, a PA, a flight medic, a EMT that's now working in their department. So when they get the call to that bad car wreck, they have medical personnel in their department that are responding before the EMS even gets notified.
Kind of goes back to what we talked about. I think it was the first medical stream we did a few weeks back. We got to know our own limitations too. Myself personally, I'd like to be able to function and be useful in an emergency situation. I don't see myself really inviting that much exposure to where I'm responding to car wrecks. Like, my goal is to never, ever come upon a trauma my whole entire life. I really don't feel that I want to do that or have the unction for it. But I would like to be able to know how to do it. So if I did have to do it, I could, or at least be in a support role to somebody with a little more knowledge and be able to function. But as far as like working for the volunteer fire department and going on calls every week to these accidents and stuff, I don't know. I don't know I don't know if that's me really. I guess I don't know.
That just depends on what you're willing to do. I mean, you have to know yourself and what you want to do too. I mean, does that mean you have to go to a car wreck and be the medic that's, crawling into the car and actually working on the patient that's crunched up in a car? That doesn't mean that's what you have to do. I mean, you can work at the volunteer fire department and let's say,
I'd like to drive the truck. I could own that job.
There you go. That, I have a commercial driver's license. I drove a 18-wheeler and have 1 million safe miles. I want to drive the fire engine for you, and they can put you in the track that'll teach you how to do that, because there are certifications you have to get for that as well. I mean, you have to
Sure.
be firefighter 1 certified. You have to go to pro board certification for that. You have to go get certified as a pump operator if you want to actually be out working on a operating fire truck with crews depending on you. You should be certified as a pump operator for the specific engine that you're on, so that if something goes wrong and there is a problem, you know how to quickly remedy that so that you don't have 5 people die on the other end of that line.
Sure. 3D Tripper saying super glue is a good thing to carry.
Yeah, that was actually designed for surgeons.
Hmm.
They made cyanoacrylate for surgeons because when they were in doing repairs in surgeries, they were noticing during the Vietnam War that the sutures would be too thick and they couldn't get these very fine structures to stick together because the suturing was too thick. So they actually designed super glue for that specific use. Surgeons could go in, put it on you, and they used it internally because your body just naturally absorbs it into you.
Sure.
And
I've
then
used it on cuts before.
Yeah. It stings when you put it on, but
Yeah, it does.
it's not that bad.
But if you're outside working, it's a good remedy. It keeps the dirt out, seals it, stops it bleeding, keeps everything out of the wound. So,
And the nice thing about it is typically it stays on there for about typically 48 to 72 hours.
yeah.
So in that time frame, typically your body's processes have already started the healing. And when the super glue itself dissolves away and is no longer helping, you actually have a scab already over the wound at that point. So it keeps it sterile the whole time.
Mm-hmm. Yeah, good item to have for sure. All right. Well, we're just about an hour. We're an hour and 2 minutes. So a lot of good information, a lot of stuff to sift through here. But appreciate you guys coming on. Appreciate having both of you here. Appreciate all the viewers. Again, encourage people to go over, check out my Patreon page, like and subscribe to this channel and to the video here, or dislike it. If you didn't like it, then feel free to say that too. We don't all have to agree. So you guys, anything in closing before we kill the stream? You guys want to say anything, sum up, the whole thing, what you've been saying, or any final comments, questions, anything like that?
There's a question from LP in the side chat there. It's
Okay.
the blood clotting pads. Typically what you're going to be doing with those, like the Z pads that you're going to get with Celox in them and stuff, that's typically going to be packing in the wound. And you personally, as somebody who's doing that, to try and save somebody's life, you should not be taking that packing out, because you need to be prepared when you take that packing out. You need to be prepared for that bleeding to start full on again, just like it was before you packed it, because that hemostatic agent works while it's there. But as soon as you take it away, and if you pull that out and you're not careful and you don't do it correctly, you pull that blood clot out, boom, it's going to start bleeding just like it was bleeding before you started everything. So that's not something at your level you should even be thinking about, is unpacking a wound. You pack it, you get a pressure bandage on it, you let somebody else do that has training, that knows what to do, and is prepared if the bleeding starts up again to control that bleeding and not use another hemostatic agent.
Yeah, we were actually, when I took the stop bleed, we actually weren't even allowed to undo it on the dummy limb. The instructor didn't want us getting in the habit of undoing something. So when we packed the wound or put the compression on, he says, that's undone at the hospital. He says, so I don't want you getting used to taking the stuff off.
Yep.
Good point.
Because what do you do in a pressure situation? You do what you train. If you train taking stuff off, you're not even going to think about it. You're going to be stupid in pressure of the situation, and you're going to take something off that you shouldn't take off. That's why you do what you do to fix something, and then you don't have any other knowledge or training, so you leave it. You fixed it, you leave it. Let somebody who knows how to do the rest of the fixing do the rest of the fixing.
Definitely.
Absolutely. All right. Well, if there's no other comments or you guys have nothing to add, I guess we'll say goodnight and wrap it up. It was a good stream. Again, I thank you both for coming. Thank everybody for coming and participating in the chat.
Thanks, Timo. Night,
Thanks,
everyone.
All right. Thanks, Bruce. Have a good night.
You too, Kevin.
All right. Good night, everybody.